This patient does not have sciatica. In this video, I'm going to introduce a real patient with pain down their leg, like this. But they do not have true sciatica. They have something called referred pain. Now, this is part 2 of the 2-part series. So if you haven't seen part 1, I would recommend you watch that video first. Before we start, I have a very specific and successful approach to treating sciatica. To get you started, I have a free book, Sciatica Recovery Roadmap. See the link in the description. Now, let me introduce Carol. Carol is a 68-year-old who came to me in a state of worry and distress. She had a 4-month history of an ache in her hip, back, thigh muscle and calf muscle. She thought she had sciatica, but also worried about her hip joint. The pain could vary in terms of location and severity, and it was a nagging type of pain rather than a sharp shooting pain. She had no muscle loss of muscle power or limb strength. That was normal. So why is this not sciatica and actually something called referred pain? Well, referred symptoms tend to be a dull ache, poorly localised, and do not produce marked sensory changes like numbness and tingling on most occasions. She did not report any sharp shooting pain or any sensory changes like that numbness or tingling, and there was no weakness in her limbs. So that would indicate that the nerve root is not being compressed. But on examination, her movement showed a stiffness, leaning backwards and leaning to her left, and with rotation, taking her knees over to each side, it was stiff. So in terms of getting this problem better, we needed to do some exercises that would mobilise the bits that were really stiff, because the bits that were stiff were irritating and the nerve was not being compressed, but it was referring symptoms away from the area. The brain was interpreting the pain as coming from down the leg rather than an irritation that was happening in the spine. So what we needed to do is mobilise the stiff bits. We found there was stiffness on leaning backwards, side bends, and rotating the knees over side to side. So what we're going to do is exercises that relate to those restrictions. So lying on your back, rolling those knees gently over from side to side in a repetitive and slow and careful manner for, say, 10 times to each side was a great way in an unloaded position of loosening up the lower section of the lower back. Another thing we needed to do is, because she was stiff when leaning over to one side, is we were going to do that as an exercise. But first of all, in sitting. So we were going to sit down and slowly take one arm down the side of the leg and then move to the other side. And this meant that we were doing some side bends, but in a slightly more open position that allowed that mobility to take place. Again, 5 to 10 times each side was enough to help to mobilise that lower back. In sitting, we were going to bend forwards at the waist. Now, what in the sitting position, it helps to open up the structures of the back. They're stretched, but they're not in an unloaded way. We wouldn't want to stand and bend forwards at the waist, which could put pressure on the lower back. We actually want to sit, which takes the pressure off the lower back. There's no load on it, but then bend forwards and stretch off the muscles, the joints, and the structures there. Finally, we wanted to try to replicate that difficulty in standing and leaning backwards, which indicates a stiffness in the segments of the lower back. And by doing that, very simply, standing with our hands on our hips and gently leaning backwards repetitively, slowly and carefully, not jerky. This is a way of moving into the range of movement that was stiff, and a bit like trying to undo a very, very tight structure, like a very, very tight nail or screw, very tight screw that's screwed into the wall. We're going to get it moving in a gentle way to begin with, but once we get that momentum going, it starts to move more and it frees up and it's easier. And so that is the same sort of principles when it comes to mobilizing exercises. It is to do it gradually, slowly at first, and then as things loosen up, to do them more extensively and perhaps a little bit quicker. Within 3 weeks, her symptoms had fully resolved. Job done. Remember, I have a specific and successful approach to treating sciatica, and to get you started, I have a free book, Sciatica Recovery Roadmap. And so you just see the link in the description or comment, yes please. So remember, when it comes to sciatic problems, when it comes to leg symptoms radiating down your leg, it's a nerve-related pain, but it doesn't have to be sciatica, which involves that nerve root compression I talked about in the first part of this 2-part video series. So be encouraged that often your pain that's going down your leg is not compression of the nerve root, but actually your brain is interpreting the pain as coming from somewhere else. It's called referred pain. And all you need to do is mobilize the bits that are stiff, and it can miraculously get rid of your symptoms. I hope that helps for you and is reassuring to you.